Arthritis is a term often used to describe any condition that affects the joints. In this video, we will show you the various types of arthritis, explore the symptoms that can occur, and above all, we will analyze in detail the crucial role that diet can play in the management of these painful symptoms. Common symptoms include joint pain and stiffness, while additional symptoms may include redness, heat, swelling, and a reduced range of motion in the affected joints. Some forms of arthritis can also affect other organs in the body. There are more than 100 types of arthritis, the main ones being osteoarthritis, a degenerative joint condition that generally occurs with aging and mainly affects the fingers, knees, and hip, and rheumatoid arthritis, an autoimmune disease that often affects the hands and feet. Osteoarthritis is associated with age and wear and tear on the joints from use, while rheumatoid arthritis is an autoimmune disease. In osteoarthritis, the cartilage that acts as a cushion between the bones deteriorates, causing pain, swelling, and stiffness. Essentially, arthritis refers to inflammation of the joints. In rheumatoid arthritis, the immune system attacks the tough membrane that surrounds all joint components, causing inflammation and swelling over time. Inflammation can damage the cartilage and bone inside the joint. Gout is caused by the buildup of uric acid crystals in the joints, causing inflammation. Lupus is a common collagen vascular disorder that can manifest with severe arthritis. Fibromyalgia is a condition characterized by widespread musculoskeletal pain. Septic arthritis is an inflamed joint disorder caused by bacterial infection. Unfortunately, there is no established cure for arthritis, and treatment options vary depending on the type of arthritis. They can include physiotherapy, exercise, orthopedic supports, medications, and, crucially, diet. Today we'll discuss the types of foods that can make your symptoms worse and explain why you should avoid them. In essence, we are shaped by what we consume, and research has shown that many people have healed themselves holistically by following the correct diet. Here are the 6 worst foods for arthritis. It's important to remember that this video is for informational purposes, and if your symptoms are concerning and urgent, it's a good idea to talk to your doctor. 1. Added sugars. Added sugars refer to sugars and syrups included in foods and drinks during their processing or preparation. They differ from the sugars naturally present in fruits, vegetables, and dairy products. Typical sources of added sugars are sugary drinks, candy, baked goods, and numerous processed foods. Excessive consumption of added sugars can lead to several factors that could worsen arthritis inflammation. Inflammation is like the body's reaction to something harmful, such as an infection. But excessive inflammation can negatively affect our joints and make arthritis pain worse. Sugary foods are often high in calories. Indulging in them can lead to weight gain. Excess weight puts additional pressure on our joints, especially those in the legs, hips, and spine, which can intensify the pain and discomfort of arthritis. Some research indicates that excessive sugar consumption may affect the proteins responsible for maintaining the strength of our joints. When these proteins break down, our joints can weaken and become more susceptible to arthritis. Insulin resistance. Consuming too much sugar can disrupt the way our body uses insulin, a hormone that regulates blood sugar levels. When our bodies become resistant to insulin, it can trigger more inflammation and other problems that could contribute to arthritis. 2. Foods high in salt. High-salt foods are foods containing a significant amount of salt or sodium. Salt is often used to enrich flavor and preserve foods. However, consuming too much salt can have negative impacts on our health, including potential effects on arthritis. Inflammation is the body's response to an injury or noxious stimulus, and in individuals with arthritis, joint inflammation contributes significantly to pain and stiffness. Consuming too much salt can trigger the release of specific immune cells that promote inflammation, which can intensify arthritis symptoms and amplify discomfort. Some types of arthritis, such as rheumatoid arthritis, are autoimmune diseases, meaning that the immune system mistakenly attacks healthy tissues, including joints. Increased salt intake could aggravate this immune reaction, intensifying the symptoms of autoimmune arthritis. Excess salt can interfere with the calcium balance in the body. Calcium is essential for maintaining strong bones and preventing bone loss. High salt consumption can lead to increased elimination of calcium through urine, potentially weakening bones over time. 3. Solanaceae. Solanaceae include a group of plants belonging to the Solanaceae family. Lately, scientists claim that certain compounds present in nightshades can intensify the symptoms of arthritis, particularly for those with inflammatory forms of arthritis. Vegetables in the Solanaceae family include examples such as tomatoes, potatoes, eggplants, and peppers. The scientific concept behind the potential association between Solanaceae and arthritis revolves around a set of compounds known as alkaloids. Proponents of the nightshade arthritis link propose that alkaloids could exacerbate this sensitivity to inflammation. This sensitivity varies widely. Some people may experience digestive discomfort or joint pain after consuming nightshade vegetables. 4th, alcohol. Consuming too much alcohol can trigger increased inflammation in your body, and this additional inflammation could make arthritis pain worse. If you are using medications to manage your arthritis, alcohol may interfere with their effectiveness. Consuming too much alcohol can also affect your bones, which is not beneficial for arthritis. Arthritis can already impair bone strength, and alcohol can exacerbate this problem by making your bones more fragile. Consider abstaining from alcohol for a period of 4 to 6 weeks and see the effects. You may notice a reduction in inflammatory joint pain, which in itself can help relieve chronic pain symptoms. 5. Purine-rich foods. When you consume purine-rich foods, your body breaks down these purines into uric acid. Some examples of purine-rich foods include organ meats such as liver and kidney, some types of fish such as anchovies, sardines, and mackerel, as well as red meats and meats such as venison. Some vegetables such as spinach, asparagus, and cauliflower contain moderate levels of purines. Usually, the body eliminates uric acid efficiently through the kidneys without problems. However, in some cases, the body may produce too much uric acid or have difficulty eliminating it effectively. High levels of uric acid in the blood can lead to the formation of crystals that build up in the joints, causing inflammation and pain. This condition is known as gout, a form of arthritis. The crystals irritate the membrane of the joints, causing swelling, redness, heat, and intense pain. Gout is most commonly seen in the big toe, but can also affect other joints such as the ankles, knees, and fingers. In simple terms, consuming purine-rich foods can increase uric acid levels in your blood, potentially causing crystals to form in your joints and triggering gout, a type of arthritis that causes significant joint pain and swelling. 6. Red meat. Arthritis is often characterized by inflammation, a situation in which the body's immune system reacts against its own tissues, causing pain and swelling. Red meat contains substances that can trigger inflammation, including arachidonic acid, a precursor to inflammation-promoting molecules called prostaglandins. Consuming red meat can increase arachidonic acid levels, potentially intensifying inflammatory reactions linked to arthritis. Red meat contains substantial amounts of omega-6 fatty acids, which are essential for the body but require balance with omega-3 fatty acids. An imbalanced ratio of these fatty acids can promote inflammation. Consuming too much red meat can disturb your health balance, potentially exacerbating the inflammation associated with arthritis. Managing arthritis can be a challenge, but with the right knowledge, medical support, and an appropriate lifestyle, it is possible to improve the quality of life and face the condition with determination. Continuing research, innovative therapies, and a growing awareness of the connection between diet and arthritis open up new perspectives for those living with the condition. Thank you for joining us as we explore managing arthritis through diet. Continue to stay informed, seek support, and take positive steps toward a healthier, more active life despite the challenges of arthritis.